Businesses today aren't the only ones looking for help. Burnout and stress are affecting employees in very real ways. Keeping employees healthy is the key to future-proofing your business. And for many companies, that starts with help from Cigna Healthcare. Don't just pay for a health plan, invest in a growth plan.
Hi, I'm Elise Labott, and today we're talking about creating a more health-centered workplace. Most employees are going to feel more supported and more productive in an environment where their employer is treating them as a whole person and their whole health. And to talk about how sometimes these health problems are invisible. We can't always see them, and employees aren't exactly sharing with their employer about things that they're dealing with. And so to talk about how employees can help with these so-called invisible health issues and create a health place where workers feel more supported, I'm joined by Jill Voslow. She's the Vice President of Talent and Wellbeing at Cigna Healthcare. Jill, thanks for joining us.
Thanks, Elise. Happy to be here.
When we're talking about health in the workplace, I think a lot of times there's this culture in America where even if we're sick, we work through, right? We don't call in for a sick day. Or we just kind of suffer in silence. Mm-hmm. And it's really hard for employers to know if employees are suffering because a lot of times they don't share it, or a lot of times these health issues aren't apparent. So what can employers do?
I think a starting place is really just the acknowledgement that these invisible health conditions are out there, right? So as we think about how to even conceptualize what we mean by an invisible health condition, they are things that very obviously just aren't apparent to the eye, right? And that means that when we don't understand that those things are happening for an individual, we're treating that individual with our sort of social and professional expectations.
Yeah, they're fine.
Yeah, healthy person. And so then when that individual needs to take a moment away for an appointment or maybe comes into work a little bit more distracted with a little brain fog.
A little sluggish.
Yeah, we haven't even conceptualized as their partner, their manager, their team, that something else is going on beyond a healthy person showing up to work every day.
Yeah, and I know that Cigna, because we've worked together over the years, that Cigna considers the whole employee and their whole health. But I think a lot of times, if it's not apparent, then that automatically means stress, burnout, mental health issues. That's what we don't see. But there's a lot more to these invisible health issues. Talk about what are some of these issues that we're talking about?
Yeah, I mean, I think it's so rich. And just to share, with you and with the audience, I too am I'm working my way through an invisible health issue, right? So I was diagnosed at the beginning of the summer with frozen shoulder. So unless you ask me to lift something heavy over my head, you would not know that my shoulder doesn't move, right? And it means, though, that from some of the issues that Alex talked about in the first session, my shoulder stops me from sleeping. That means that when I come into work in the day, I'm a little foggy. My shoulder keeps me from being able to do all of the activities that I would normally do to work every day. I don't like to move my arm, and as a result of that, I delay typing things. That means that sometimes I put off getting something done, making the notes, sending out the email, whatever. And ultimately, I have to spend time away from my workday pursuing healthcare, asking questions about where I should go, what I should be doing. I need to take time away to do those appointments. And in that span of things that I deal with in my own invisible health condition, most of my colleagues know that's going on for me. I'll show up on video and I'll have a heating pad on my shoulder that lends itself to an invitation for people to ask what's going on.
Right, but I think, I'm sure there are a lot of people in this room that are like in chronic pain of some issue or another, and they just don't tell anybody.
Right.
But there are a lot of other health issues that we've discussed.
Right. So it wraps further out into things that we probably do think about in the chronic condition space: diabetes, asthma, arthritis, like those sort of crippling abilities to do some of the things that you need to do every day. Further out into the mental health space, many people can be operating on a daily basis with depression or anxiety and not demonstrate that in a way that you know that there's a challenge for them. Neurodivergent individuals who might be working through ADHD or maybe on the autism spectrum. And then it even wraps sort of further out into like challenges that come from societal or external factors. So someone who is a caregiver and is struggling with the demands of like a new situation for themselves and maybe the stress that comes from that. Individuals who are just discovering what it means to be in menopause, struggling with isolation or loneliness, and ultimately even just the challenges of some of the inequities of the healthcare system. Like those things in and of themselves can be challenges for an individual that we're not watching for and we don't know are things that may need support.
Let's talk about some of the costs associated with this mental health issues. Some are visible, like they cost money, but some are also invisible to the overall health of the company.
Mm-hmm. Yeah, I think that the most tangible and measurable ones are always things like utilization of the healthcare system, right? Like that is a cost to the individual, it's a cost to the company's health plan.
Or a sick day.
I'm sorry?
Or a sick day.
Yeah, and for sure, I mean, sick days, not only are sick days, like they're a payment that the employer is making for somebody when they're not at work, but it means that we're losing the productivity of that individual. And I think even from an individual's perspective, like what if you work somewhere that you don't have a paid sick day or paid time off? It can be really detrimental. And I think back to your point at the beginning, it can be a place where people don't choose not to come to work.
Yeah, they come to work, but they're not exactly like productive or...
Right.
That's where you go into the invisible.
Right, in that moment where it would be more supportive for the person to take a day off and stay at home. And like since we started talking about musculoskeletal issues with my arm, we know that 1 in 2 Americans suffer with some aspect of musculoskeletal issues, and that leads to more time away from work than any of the other chronic conditions that we have. Ultimately, a $420 billion cost to the healthcare system.
$420 billion just for musculoskeletal. That back pain, that that frozen shoulder. That's more than heart. We were talking. That's more than heart disease or any other chronic condition.
Yeah. So I am the benefits leader at my company in addition to being a Cigna employee, and it's the thing that we struggle with the most in our own employee population. $100 million, my health plan for my employees, that musculoskeletal condition.
What's the cost on productivity now? These are like less visible costs.
As an individual, perhaps feels like unseen and disconnected from the workplace. They couldn't begin to step away from being engaged every day. I think that the holistic impact from a productivity perspective comes from the examples that I gave you about myself, right? I need to be going away to my physical therapy appointment, or I am distracted because I am spending some time like planning my next healthcare experience, even though I'm sitting at my desk. But ultimately it wraps further out into things that are less measurable, like the brain fog that might come from being at work when you didn't get good sleep, or maybe the brain fog that comes from dealing with menopause.
Or pain.
Pain, for sure. Like pain is very much a distraction. I mean, I told you my story of the way that maybe I'm not typing because I don't want to re-aggravate what's happening with my arm. And so all of those things kind of collect together in a way that it's lost productivity for the individual, lost productivity for the company. So of course, it makes a lot of sense for employers, both, we definitely bring the humanistic lens to the way that we think about our employees. Like we bring our mission to our employees and we care about them. But for any employer, and kind of back to the way that Kelly was talking in the last session, there's just so much value just in improving the productivity experience of your company by ensuring that people can stay well and have the support that they need to get to resources when they're looking for it.
Okay, so let's go deeper on that. How can employers start thinking about addressing these invisible health issues in the workplace that their employees are struggling? Because I think we don't realize that more people are probably struggling with them than we know.
Right. I do think the starting place for anybody, again, kind of hearkening back to that last session, is beginning to focus on creating an open culture that allows people to talk about it. Like, we start that conversation for ourselves very similarly. We do a lot of storytelling. We use all of our internal communication channels to ensure that employees can see sometimes our C-suite individuals, but sometimes just another employee that looks like them, working through one condition that, again, maybe if you were interacting with me at work, you would never know that I was struggling with something, but I share publicly that I have a challenge I'm working through, and then we partner that openness and destigmatization with highlighting the resources that we're offering to employees to help somebody step in and begin care through a navigation channel, through a coaching channel, through a social community that we might have at work, to ensure that they feel resourced and surrounded by people that care about getting to a good solution.
Because sometimes there's judgment. I remember one time I was telling you earlier, I went to my supervisor and I said, I have to go to an acupuncture appointment. And he was like, acupuncture? Because, this was I was dealing with a health issue, and the doctor recommended acupuncture, but there's a judgment and there's a stigma in some of these issues.
Right. I think the more that we can do, ultimately, again, the power and the value for the employer is we're caring for the person early, we're helping them get to resources early, and in doing those things, we're shortening their recovery time, we're keeping them at work. So we're motivated to make sure that we're creating an environment where if acupuncture is the right thing for you, we bring support to it. So it does start with the manager, it does start with the team. It starts with a manager establishing a one-on-one relationship with an employee in a way that allows a sense of freedom to talk about what's going on, so that then the manager can be the first line of resources to point you to where you need to go, and your team might also be able to surround you and give you the support to get into programming, tools, etc.
Okay, so we have a lot of employers in this room. What is the one thing they can do to take a more proactive approach to helping employees better manage, their health issues and help the business thrive?
I do think that ensuring that the resources that you offer are packaged in a way that it's easy for the individual to find where to start. So we're fortunate, right? We leverage a handful of navigation resources that our Cigna and Evernorth partners offer as solutions. So in an example from our workplace, as we realized that we needed to support richer access to mental health, then we instituted a product that allows navigation at the front end. Someone calls one person and says, I need help. And the navigator helps them then move through the experience, find a therapist, find other resources, and then ensures that they're cared for kind of on the back end. So I think that every way that you can make it simple and then wrap around that culture of understanding, so that individuals know that they know where to go to find a solution, and they know that once they've identified a solution, there'll be support in the work community to care for themselves and be as healthy as possible, as quickly as possible.
We just have a little time left, but what about in terms of being more proactive, offering services? You had mentioned that Cigna has some programs for, everyone will do some, meditation, or everyone will do some exercise? How about, seeking them out before they notice that they're telling you that there's a problem?
Yeah, we do a lot. We do a lot as a community, and I feel like that sometimes is missing in the way that we bring through these support threads, but any place that a person can have a partner and a commitment routine or whatever. So we leverage resources like we are a participant in the Peloton business solution, and we'll leverage that programming that we provide for free to our employees to ensure that like once a quarter, hopefully we're not having the summer Fridays or whatever that were in that last question, but on a really regular basis, we're saying everybody together, let's do a meditation practice. Everybody together, let's focus on mobility. And through that, that is a really great reinforcement of those cultural aspects, because it means that all the time, even when you're well, we're talking about wellness.
Yeah. Well, I think what you're saying is it's good for the employer and it's good for the employee. And we know that healthy, productive employees make healthy, productive companies and organizations that prioritize and invest in the workforce's future health will be ones that will thrive in the future. Jill Vaslow, Vice President of Talent Strategy and Employee Wellbeing at Cigna Healthcare. Thank you so much for joining us. Such an important conversation.
Thank you.
Thank you.